Our eyes are our windows to this world. Our eyes enable us to see everything from ourselves in a mirror to the abundance of colors, shapes, distance, movements, and all the natural beauty of the world. Hence, eyes are the very reason that our brain is able to replay our pictographic memories when glancing through old pictures. But unfortunately for some of us, as we near middle age, the sharpness of our vision deteriorates or things start appearing blurry or not as bright as they were before. In some instances, we might find that straight lines now appear wavy or hazy. And one can also find an annoying black blind spot developing in the center of our view. There could be various reasons behind why one experiences any of these symptoms, but an early diagnosis of the condition and determining if it is due to retinal vein occlusion or RVO and treating it immediately is very important. RVO is an eye disorder which is the second most common cause of reduced vision or vision loss due to problem in blood vessels of the eye. The proportion of patients suffering from RVO increases with advancing age. In the beginning, people with RVO have difficulty with their vision, but often ignore this symptom because it is painless and appears to be just aging-related. However, the condition steadily worsens and, at times, becomes irreversible. To understand what causes RVO, we need to first understand what is retina. Retina is a thin membrane that lines the curved inner surface of the back of the eye. It is similar to the film in a camera where an image falls and is captured. The center of the retina is called the macula. Blood vessels carry blood throughout the body, including the eyes. The blood vessels that carry blood away from the heart and towards the organs of the body are called arteries. The blood vessels that carry blood away from the organs and towards the heart are called veins. Sometimes, the vein that carries blood away from the retina of the eye gets blocked by a blood clot. This causes RVO. If this blockage occurs in the central vein of the retina, it is called central retinal vein occlusion. If the blockage is in one or more of the small branches of the central vein, then it is called branch retinal vein occlusion. While there is no single known cause of RVO, it usually occurs due to the combination of several factors. Narrowing of the blood vessels due to the compression by adjacent blood vessels in the retina is one of the major factors in the onset of the problem, along with slowing of the bloodstream, changes in the blood vessel wall, or changes in the properties of the blood. One or all of these factors can contribute to the formation of a blood clot. High blood pressure, diabetes, high cholesterol, and smoking are also factors that can cause RVO. Though the condition initially is painless, complications like secondary glaucoma can occur because of formation of new blood vessels that do not allow the fluid from the eye to be drained, thus leading to increased pressure within the eyeball, which can often be painful. Possible complications resulting from RVO include macular edema or neovascularization. Macular edema is swelling of the center of the retina called macula and can lead to permanent visual problems. Neovascularization, on the other hand, is formation of new and abnormal blood vessels at the back of the eye. About 1/3 of patients diagnosed with RVO develop this problem. This abnormal formation of blood vessels leads to increased pressure inside the eye and can result in glaucoma, bleeding, or in some extreme cases, the risk of retina getting detached from the inner surface of the eyeball. It is a well-known fact that human body entirely functions on the basis of various chemical signals. In RVO, the chemical called vascular endothelial growth factor, or VEGF, along with the mediators that promote inflammation like TNF-alpha, IL-6 and 8, ICAM-1 and MCP-1 cause formation of new blood vessels, vascular leakage and inflammation, all of which ultimately result in macular edema. One of the common treatment options for RVO is anti-VEGF drugs. Although anti-VEGF drugs reduce formation of new blood vessels and leakage from blood vessels, they do not reduce the inflammation of the retina and therefore do not help with reduction of macular edema of the retina. Moreover, anti-VEGF require to be injected into the eye once every month in order to be effective. Bridging this gap and going forward is Ozurdex. Ozurdex is clinically proven to be highly effective in patients with RVO. Ozurdex is a biodegradable implant containing dexamethasone, which belongs to a class of medicines called corticosteroids. Ozurdex, with its quick and sustained action, heralds a new era in the management of RVO. Ozurdex is used for the treatment of the swelling of the macula or macular edema following branch or central RVO. The key to the effectiveness of Ozurdex is the sustained release of the drug dexamethasone from the intravitreal implant. Since Ozurdex is given as an injection deep into the eyeball, the implant is often released very close to the retina where the drug needs to act. The sustained release formulation of Ozurdex allows the medicine dexamethasone to be released slowly over a long period of time. Thus, Ozurdex provides vision improvement for up to 4 to 6 months following a single intravitreal injection. Because of this special drug delivery system as an implant, patients only need to receive one injection in 4 to 6 months. Each Ozurdex implant slowly dissolves when it comes in contact with the vitreous gel that fills the eye, thereby releasing the medicine dexamethasone, which helps in reducing swelling or inflammation due to RVO. Ozurdex helps to reduce the swelling in the center of the retina, called macular edema, by suppressing inflammation, which in turn helps decrease leakage from blood vessels, movement of inflammatory cells to other areas of the retina, strengthening of tight junctions, reduction in the formation of new blood vessels, and ultimately results in improvement in the symptoms of macular edema. As symptoms of macular edema resolve, Ozurdex helps in improving vision in patients with RVO. Ozurdex effectively provides sustained vision improvement in the patients with RVO. Like all other medicines, Ozurdex can cause some side effects. These side effects usually vary from person to person. The most common side effect includes increase in intraocular pressure, IOP, which is temporary and which your doctor will know how to manage. Please consult your doctor for more information about RVO and how Ozurdex can help you improve your vision.